Welcome to our continuation on our discussion over the digestive system. In your notes, this is going to pick up underneath the taste buds, which is where we ended with part 1, specifically looking at palatine tonsils. So the tonsils are in the back of the mouth. We can see them labeled in this image right here, and there would be another one over here. These are in the mouth, so they're associated with the digestive system, but they're actually lymphatic tissue, so that makes them part of our immune system. So we're going to check out a couple videos about these tonsils, namely tonsillitis and tonsil stones. And on your paper, you're going to have a couple questions you're asked to answer regarding these. What is it, and what are the signs and symptoms? So I'm going to play these videos, fill in those questions on your paper as you check them out. This first video talks about tonsillitis.
And what we see here is a case of severe tonsillitis. You can see the exudates on the tonsils. Focus again. Yeah, you can see the exudates on the tonsils, and you can see how large, red, and swollen they are, and the contrast on the color between the inflamed tonsils and the rest of the oral cavity, which is pink. So this will be treated, we're in the United Kingdom, this will be treated with penicillin V, and we expect the patient to be back to normal soon.
And our second video is going to discuss tonsil stones. So what we saw with the tonsil stones was the removal of some hard rock-like objects, the tonsil stones. As you can see with that last video, there's kind of some nooks and crannies back here that occasionally things can get kind of trapped inside of. These would be things like bacteria, dead cells that kind of get crammed back in there and trapped, mucus. All these things can kind of get trapped back within those nooks and crannies, and when they do, over time, they harden or calcify. What this would result in would be, I would imagine, some really awful breath, sore throat, You can see white debris sticking in the back of people's mouths, depending on how severe the tonsil stones are. This could also cause problems with swallowing, could be ear pain, and also could lead to tonsillitis. Moving along, there are teeth. There's two types. There's primary or baby teeth, and then there's secondary teeth. Primary teeth are usually only in our mouths for the first 5-7 years of our life, and then they fall out, and we have our secondary or adult teeth replace them. So there's roughly four different types of teeth in our mouth. There's the incisors up front, the cuspids, also known as the canines, the bicuspids, and then our molars. And each of these, as you can feel in your own mouth, they have a different shape. And because they have a different shape, each of these teeth have a different purpose. For example, the incisors, if you feel in your mouth, they're kind of flat and blade shaped, which are perfect for biting into food and clipping off pieces of food. Whereas the cuspids, which are our vampire teeth, are not flat, but they're not blade shaped, but they're not flat like our molars and bicuspids either. These would be used for ripping and tearing tough foods, things like meats, if you need to rip something off. Picture a dog trying to rip off a piece of food. It's using its cuspids to do that. Bicuspids and molars, these are flatter teeth. Both have the same function. The molars larger than the bicuspids, but these would be used for kind of grinding and mashing food within our mouth. You can kind of imagine how difficult it would be to sit and try to chew up a piece of meat using just these front teeth. Could do it, but it's the wrong tool for the job, and it would take a long time to do. Likewise, using our molars to try to rip through a piece of steak and bite off a chunk of it. It's not going to really do a lot of tearing like we want with the cuspids. Moving into the anatomy of a tooth, and you do have this one. You will need to add in this one, the cementum or periodontal ligament, as it's not included on your image. So take a moment, fill these in, and then we're going to talk about each of these a little bit. So this picture is showing us either a bicuspid or a molar, and we know that looking at the large flat top on the tooth, but this is kind of true of all teeth. They're just using this type of tooth for the example. We're going to start by looking at the crown that's on the top of your list, which is right here. Notice the gum line is right here. So the crown, what is it? It's the part of the tooth that we actually can see. When you look at someone's mouth and they smile, you're seeing the crowns of the teeth. Deep to the crown, underneath the gums, is the root. The root is the part of the tooth that's embedded within the jaw. Next, you have the enamel, which is this white stuff right here. Enamel is the hardest substance in the human body. It's incredibly durable and incredibly strong. It covers the crown. So the enamel covers the crown of the tooth, and it's made up of calcium salt deposits, which create that very hard substance. Underneath the enamel, we have the dentin, which is this brown substance right in here. The dentin, it's similar to bone, but it is harder than bone. It encloses the pulp cavity. So here's the pulp cavity right here. The pulp cavity is where the blood vessels are located. So we can see all these blood vessels going up into our tooth. So it has blood vessels. There's also nerves. The nerves extend through the root canals. Surrounding the outer layers of the root, we have the cementum. I have cementum and periodontal ligament kind of as one, but they are two different things. The cementum would be the surface of this brown layer right here of the root. So the cementum just kind of covers it. The periodontal ligament, that's what actually connects the tooth to the bone and holds it in place. On your paper, you're going to be asked to fill in some of that information regarding each of the different components of teeth. Within the topic of teeth, we're going to be talking about cavities. A cavity occurs when a hole develops through the enamel, through the dentin, and into the pulp cavity, which could lead to some serious problems, which is usually why they try to catch cavities and fill them before they get deep. Once it were to get deeper, then you would have much more serious problems. As we can see by this child, I can't believe how bad these teeth are at this child's young age. With all this black tartar that's built up, definitely would lead to some cavities. Now, if the cavity were to go all the way to the pulp cavity, the problem would be, well, there's some delicate tissues in there. There's blood vessels which connect to the entire body, nerve endings, and that stuff can get infected. And if it does, that's kind of when you need a root canal. So let's check out this video on root canals, as it will give us a little bit more information.
A root canal, or endodontic therapy, is a treatment to remove infection from the nerve tissue and blood supply of the tooth. Infection of this tissue can be caused by severe tooth decay, severe periodontal disease, a cracked tooth, or an old filling. The procedure begins by drilling a hole in the chewing surface of the tooth to gain access to the pulp chamber. Once exposed, the soft tissue is completely removed, and the canals are shaped using a series of files. The hollow canals are then filled with an inert pink polymer called gutta percha. After the procedure is completed, a crown is needed to protect the tooth, which will now be less resilient due to lack of blood supply running to the tooth. Historically, root canal therapy has been one of the most feared procedures in dentistry, but with modern techniques, anesthetics, and medications, today's endodontic treatments are both fast and painless.
Impacted teeth. These tend to occur usually with the wisdom teeth, and they're when the teeth don't grow in straight. And as we can see by this x-ray, this one is definitely not straight, this one is definitely not straight, and that's going to put pressure on all the other teeth, cause teeth crowding, cause teeth to be pushed out of position, and a lot of pain. These would definitely need to be surgically removed. And lastly, salivary glands. There's a couple different glands within our mouth. There's the parotid glands, the sublingual glands, and the submandibular glands down here, all secreting saliva mixed with amylase. And we spoke of amylase previously. It's used to break down carbohydrates. It mixes in with foods right here in our mouth. And this is if you've ever done the test where you put a cracker in your mouth and you time how quickly it dissolves. You're actually testing how quickly the amylase reacts with those carbohydrates. The mucus within the saliva not only has this amylase to start the digestion of the carbohydrates, but it also moistens and liquefies the food, which makes it easy to swallow. I think you probably have all had a moment in your life where you tried to swallow a chunk of food that was just dry and didn't really go down all too well. This concludes this section of the discussion. Next we'll be moving into the pharynx and then the esophagus and stomach.